Hello future nurses. Welcome back to Hank's Academy Nursing Review, where we help you learn smarter, test confidently, and pass NCLEX on your first attempt. In today's session, we're reviewing 60 of the most commonly tested NCLEX questions, along with quick rationales to strengthen your clinical reasoning. Grab your notebook, take a deep breath, and let's get started. And remember, you are capable, smart, and born for this journey. NCLEX Practice Exam, 60 questions. Safety and Infection Control. 1. A nurse prepares to insert an indwelling urinary catheter. Which action prevents infection? A. Place sterile gloves over clean gloves. B. Maintain sterile technique during insertion. C. Wear clean gloves only. D. Clean meatus after catheter insertion. Two. A client with TB is hospitalized. Which precaution is required? A. Droplet. B. Airborne. C. Contact. D. Standard only. Three. A nurse caring for a client with C. difficile should A. Use alcohol-based sanitizer. B. Wear N95 mask. C. Wash hands with soap and water. D. Avoid gloves unless soiled. Four. Fire alarm sounds on the unit. First action? A. Extinguish fire. B. Evacuate clients. C. Activate fire alarm. D. Rescue clients in danger. Five. A nurse delegates to a UAP. Which task is appropriate? A. Insert a NG tube. B. Administer oral meds. C. Apply barrier cream. D. Perform wound irrigation. Six. A nurse notes a confused client leaving the unit. First action? A. Call hospital security. B. Escort client back to room. C. Notify provider. D. Restrain client. Health promotion. 7. Best food for iron deficiency anemia? A. Chicken breast. B. Spinach. C. Cheese. D. Yogurt. Eight. A client takes warfarin. Which food should be limited? A. Tomatoes. B. Leafy greens. C. Milk. D. Bananas. Nine. Recommended immunization for newborn? A. MMR. B. Hepatitis B. C. Varicella. D. Influenza nasal. Ten. For breast self-exam, a woman should perform it. A. During menstruation. B. 1 week after menstruation. C. When breasts are tender. D. Before menstruation begins. Psychosocial integrity. 11. A client states, "I feel hopeless." Priority nurse action? A. Offer advice. B. Assess suicide risk. C. Encourage deep breathing. D. Change the topic. (12) Best response to client with anxiety? A. Calm down now. B. Tell me what you're feeling. C. There's nothing to worry about. D. You should sleep. (13) Priority for client experiencing hallucinations? A. Touch patient to comfort. B. Ask about content of hallucination. C. Agree with hallucination. D. Ignore hallucinations. (14) Bipolar manic phase priority? A. Provide group therapy. B. Offer high-calorie snacks. C. Encourage deep conversations. D. Allow unrestricted activity. (15) Dementia versus delirium? Delirium has A. Gradual onset. B. Rapid onset, reversible. C. No change in LOC. D. Permanent memory loss. Basic care and comfort. 16. Prevent skin breakdown in bedridden client. A. Turn every 2 hours. B. Use donut cushion. C. Apply talc powder. D. Lower protein intake. (17) High fiber food? A. Eggs. B. Oatmeal. C. Milk. D. Chicken. (18) Best position during tube feeding? A. Supine. B. Semi-Fowlers. C. Trendelenburg. D. Side-lying. (19) Best snack for a client on potassium-restricted diet? A. Banana. B. Orange. C. Apple. D. Spinach. (20) Oral care for unconscious patient. A. Place supine. B. Turn to side. C. Brush only once a day. D. Avoid suctioning. Pharmacological and parenteral therapies. 21. Digoxin toxicity symptom. A. Polyuria. B. Yellow vision halos. C. Tremors. D. Diarrhea only. 22. Safe insulin mixing technique. A. NPH into regular. B. Regular into NPH. C. Shake insulin vigorously. D. Use 1 syringe per insulin. (23) Warfarin antidote. A. Vitamin K. B. Protamine sulfate. C. Naloxone. D. Atropine. 24. Best time to give statin medication. A. Morning. B. Night. C. With milk. D. Before exercise. (25) Pain control priority after morphine dose. A. Measure pulse. B. Assess respiratory rate. C. Give fluids. D. Offer food. 26. Peak and trough monitoring is for. A. Acetaminophen. B. Vancomycin. C. Ibuprofen. D. Omeprazole. 27. Metformin should be held before. A. MRI with contrast. B. X-ray. C. Ultrasound. D. Physical therapy. 28. Client taking ACE inhibitor reports cough. Nurse should. A. Stop drug and notify provider. B. Encourage fluids. C. Give antihistamine. D. Continue medication. 29. Hypoglycemia treat with. A. Peanut butter sandwich. B. Orange juice. C. Cheese. D. Steak. 30. Long-term steroid use complication. A. Weight loss. B. Hyperglycemia. C. Hypotension. D. Low infection risk. Attention nursing students. Your journey to becoming a licensed nurse is just a step away. To support you on this important path, like, share, and subscribe for expert tips, motivational content, and comprehensive review materials. If you need personalized guidance, extra practice, or one-on-one support, we're here to help. Reach out to us through the contact details in the description box. Together, we'll turn your NCLEX dreams into reality. Stay motivated, stay focused, you've got this. Reduction of risk potential. 31. Priority lab for heparin therapy? A. INR. B. APTT. C. Platelets only. D. PT only. 32. Chest tube dislodged, first action? A. Call provider. B. Cover with sterile gauze. C. Cover with occlusive dressing. D. Place client prone. (33) Best site for IM injection in adults? A. Deltoid. B. Vastus lateralis. C. Dorsogluteal. D. Ventrogluteal. (34) Client on 2LO2 nasal cannula. SpO2 equals 84%. Priority? A. Increase O2 flow rate. B. Encourage deep breathing. C. Remove cannula. D. Place supine. (35) Post-thyroidectomy emergency equipment. A. Foley catheter. B. Tracheostomy tray. C. NG tube. D. Tongue depressor. (36) Central line infection sign. A. Bradycardia. B. Redness and drainage. C. Clear yellow drainage. D. Hypertension. (37) New colostomy normal finding. A. Pale stoma. B. Purple stoma. C. Moist, red stoma. D. Dry stoma. (38) Priority assessment before MRI. A. Shellfish allergy. B. Metal implants. C. Weight. D. Pregnancy test only. (39) NG tube placement verification. A. Air auscultation. B. X-ray. C. Aspirate color only. D. Tape tube. (40) Best action for infiltration for. A. Elevate limb and remove 4. B. Apply heat only. C. Flush line. D. Ignore unless swollen. Management of care. 41. Ethical principle of doing good. A. Autonomy. B. Beneficence. C. Justice. D. Veracity. (42) HIPAA violation example. A. Closing client door. B. Displaying name visibly. C. Discussing client in elevator. D. Handoff report at nurse's station. (43) Client refuses med, nurse should. A. Force med. B. Document refusal and notify provider. C. Discharge client. D. Ask family to convince. (44) Living will describes. A. Burial wishes. B. End-of-life care wishes. C. Property division. D. DNR orders only. (45) Priority patient. A. Post-op day 3 coughing. B. Chest pain radiating to arm. C. Nausea from chemo. D. Mild headache. (46) SBARA stands for. A. Action. B. Assessment. C. Arrangement. D. Admission. (47) Task for LPN. A. Initial teaching. B. Administer 4 push meds. C. Monitor wound drainage. D. Develop care plan. (48) Which client to assign to UAP? A. New diabetic. B. Stable stroke client bathing. C. Post-op day 1 trach care. D. Chest pain client. Physiological adaptation. 49. Priority in sickle cell crisis. A. Ice packs. B. For fluids and pain meds. C. Restrict fluids. D. Exercise. (50) COPD oxygen goal. A. 100%. B. 94 to 98%. C. 88 to 92%. D. 70 to 75%. (51) DKA expected finding. A. Bradycardia. B. Kussmaul respirations. C. Low ketones. D. Alkalosis. (52) Heart failure teaching. A. Increase sodium. B. Daily weights. C. Increase fluid intake. D. Avoid walking. (53) Cushing syndrome sign. A. Bronze skin. B. Moon face. C. Weight loss. D. Low BP. (54) Priority for severe asthma attack. A. Encourage rest. B. Administer bronchodilator. C. Offer fluids. D. Teach breathing exercises. (55) Post-stroke dysphagia care. A. Thin liquids. B. Check gag reflex. C. Tilt head back. D. Offer straws. '56. Appendicitis expected finding. A. LLQ pain. B. RLQ pain. C. Rebound tenderness absent. D. Pain relieved by pressure release. '57. After seizure. A. Insert airway. B. Place client side lying. C. Sit client upright. D. Hold down limbs. '58. Hypothyroidism symptom. A. Weight loss. B. Heat intolerance. C. Bradycardia. D. Diarrhea. '59. Hyperkalemia ECG finding. A. Flat T wave. B. Tall peaked T waves. C. U waves. D. Prolonged PR only. '60. Burn patient priority. A. Nutrition. B. Airway and fluid resuscitation. C. Pain control. D. Elevate legs. Attention nursing students. Your journey to becoming a licensed nurse is just a step away. To support you on this important path, like, share, and subscribe for expert tips, motivational content, and comprehensive review materials. If you need personalized guidance, extra practice, or one-on-one support, we're here to help. Reach out to us through the contact details in the description box. Together, we'll turn your NCLEX dreams into reality. If you found this resource valuable, make sure to subscribe, like, and share, so you don't miss out on more practice and helpful content. Stay motivated, stay focused, you've got this.